So what on earth ever happened to repeal and replace? Arizona Congressman and Freedom Caucus member David Schweikert joins me. Congressman, welcome to the show.
Hi there, Kennedy.
Well, I've got some questions for you because I was not a big fan of the first version of the AHCA. I spoke with one of your counterparts, Tom McClintock, who happens to be a conservative from California, very lonely there. And he said that he had problems with it, but he was ready to support that first draft. Why are you in favor of something that is so eerily similar to Obamacare?
Well, Kennedy, you have this world we now live in, and there's this thing called math. And the problem is, soon as we as a society said, hey, guaranteed issue, people with pre-existing condition have guaranteed issue, you've already created the box. Now the debate is, how do you pay for it and who pays for it? So we've already created the limitation. That is saying we're now a country that has guaranteed issue. We've had it for business and Medicare and Medicaid and tribal health care and VA for many years. Now it's for that tiny sliver of the population that buys in the individual market. Now they have guaranteed issue. So now it's all about how do you pay for it.
Oh, so you just accept the status quo? Completely unprincipled, without questioning why we might have something guaranteed like that in the first place?
Yeah, well, here's your problem, Kennedy. If you've already decided that someone who walks into the emergency room is going to get health care, the cost is already in the society. Unless we as a conference and as a country are willing to say, hey, you show up with cancer, you're not getting services, you show up with a bullet wound, you're not getting services, the cost was already being paid for. Now, it was being hidden in sticking it in other people's insurance. It was being hidden in other types of taxes. But
Absolutely.
It's been part of this society for decades and decades and decades.
I agree with you completely that the system, now, Congressman, I agree with you that the system is so deeply flawed. And I agree that costs have been offset into various programs and taxes, and they have been hidden, and they have been coded within the medical system, and that is absolutely egregious. So there's something you can do here. You can actually use some sunlight to show how ineffective that system is, and then you as a lawmaker have the power to change that system. But instead, the argument you're giving me is this is already happening, so we're going to go ahead and let it happen. That's like seeing an alcoholic at the bar and giving him your car keys, assuming that at some point he's going to drive anyway.
Yeah, Kenny, absolutely backwards. Look, the costs are already in the system, so we might as well be honest that they're there. There's only really three things that drive down the actual cost of health care. And one is transparency, knowing what do things really cost, competition, and technology. And I believe we're now weaving those things and trying to create that sunlight and that competition into what we're trying to do in this legislation.
Okay, I will tell you this. Obamacare is a lead blanket. No sunlight is going to get through that. This version of the AHCA, the last version of the AHCA, you only removed about 1 millimeter of lead. It's still several inches thick. There is no transparency. This is still a government-run system. You have shifted the subsidy, so people are no longer paying the government. They're now paying insurance companies, so that's another form of cronyism. The competition has already been stifled. There is no real solution for competition. Therefore, there's not going to be technology and innovation, which is so necessary.
Yeah, you're absolutely wrong, I believe. Let's take 2 steps backwards. Back to the first part of the conversation. Do you at least agree the cost box is the cost box? Whether it had been being paid for insurance, or people not, losses at hospitals, or doctors not getting compensated, the cost was in society. Do you at least agree to that people were getting health care?
Yes, when systems are compromised.
No, if you at least agree to that, we know the cost
I agree there was fraud within the system. I do not accept the mechanism that delivers fraud.
Okay, but now we have the next phase we have to engage in. That is the transparency, the competition, and the embracement of new technologies. And that technology,
I agree with you
completely.
I don't see it in this bill. I share your optimism. I agree that that is how we will move the economy forward. If we get the government out of health care, that can flourish, and hopefully the next steps that you as lawmakers take, it will be with our best interest and the economy's best interest at heart. Congressman, thank you very much for taking the time. I appreciate it.